Okay, so what we have said? We have said that this is the interaction between antigen and antibody. Okay, so antigen is the streptolysine O and the antibody is anti-streptolysine O. In between there are multiple different what we call interactions, as we have shown you this area. Remember, now in this area there are multiple different kinds of what we call geometric compatibility, electrostatic compatibility, and so on. Therefore they are coming together, not in any other site. At a particular site only they'll come, and eventually they'll get precipitated due to their higher molecular weight. Understood? So where they'll get precipitated? They'll get precipitated at a vascular tissue like glomerulus, valves of heart, synovial of large bones. The ball and socket kind of joints are there in between, the lubrication and all such things, synovial membrane and this and that. There it will precipitate. Now that is fine, precipitation has taken place. But the problem here is how nephritis will take place, titis, the inflammation will take place. The inflammation will take place because there is somebody called neutrophil or all the macrophages which will look for this kind of antigen antibody interaction. These are not natural things. They should get eliminated from the body, isn't it? So they'll try to eliminate it by what? देखिए इस तरह से वो करेगा, वो खाने का कोशिश करेगा, इसको पूरा निगल जाएगा. कैसे निकलेगा देखिए. You see this, what you call a small, this thing, what you call is this animation, okay, you will understand. Now this is the neutrophil, it's ready for what? Elimination of this antigen antibody complex. So it will come due to the chemotaxis, by diapedesis it will come and try to eliminate it. Now while eliminating it, it will also eliminate the tissue where it has been deposited. Can you get, so you can see, no? So what will happen is the tissue inflammation will take place. Your glomerulus will get infiltrated by so much of infiltrating neutrophils, and eventually what will happen, you will start leaking protein through your urine. So proteinuria will take place, and then eventually you will have some kind of edema. Okay, the water retention will take place, there will be abnormality in electrolytes, and eventually it can go wrong multiple different ways. People can have like this thing, what you call pani jam jayega lungs mein, and then there may be some abnormality in heart because the stroke volume will change. So much of thing will take place. Getting? So this is how, and the person will also have this pyuria. The body temperature will be increased and antipyretic will be suggested. So there will be low grade fever in the evening, kind of, not always, but there will be low grade fever, and डॉक्टर पागल हो जाएगा, वो देखेगा ये सर बहुत ज़्यादा है, उसके बाद CRP भी ज़्यादा है, लेकिन मतलब समझ में नहीं आएगा कि क्या प्रॉब्लम क्या है. वो सबसे पहले सोचेगा ट्यूबरकुलोसिस का टेस्ट कराएगा, तो देखेगा कि ट्यूबरकुलोसिस नेगेटिव है, एंटीबायोटिक स्टार्ट करने का ज़रूरत नहीं है, तो फिर वो सोचेगा ASO कब आ रहा है. सो ASO जब बहुत ज़्यादा होगा, 2000-3000 टॉड यूनिट्स, सो इट विल स्टार्ट this what you call this beta lactam regimen. Okay, so this is how the infective role of rheumatism is there, rheumatic fever we will say. So there is a completely different autoimmune aspect also, but I do not think I will able to this thing do justice to this topic also today. Okay, now these are the whole this thing of what you call this infection oriented rheumatic fever and rheumatic disease. Okay, not rheumatic arthritis. RA is there, it's a different, this is also an immunological this thing only, but it's a little bit different because there is a complete autoimmune aspect to it. Okay, so now is this possible for you guys, those who are having immediate this thing? Otherwise people, you can write down a particular kind of this thing by using your internet only. I'll give you a topic to all of you. I have not this thing, there are multiple different things we need to discuss. You can write down a topic. आप थोड़ा इसको अपने आप ही स्टडी कीजिए और देखिए इसके बारे में आपको क्या कुछ मतलब इंफॉर्मेशन है. Clinical trials on clinical clinical trials on uh, streptococci. It is not completely this thing, microbiology or pathology. It is for general purpose also. So it will serve some idea. You will have some more idea. Clinical trials on streptococci infections. Okay. So you search and you write the abstract of you undergo the abstract of 10 different clinical trials that has been taken place to tackle streptococci infections of different therapies. Okay, then you prepare a write up in soft copy only. You can submit it in word file also. Okay, tomorrow we will not have a class, so if you can do it by tomorrow, that will be great, and submit all of you. You can either submit in the group itself, or you can privately also you can send. Those who are having very less time practicing clinicians, in free time when you are this thing, then you can also Google and try to prepare it. Okay, see at least 10 clinical trials, report on 10 clinical trials. Okay, science people who are not doing hectic this thing, they can also do it. They can increase it by 10 more numbers, 20 different clinical trials on streptococci infections. Okay, so you submit it by tomorrow. In the night also you can submit, tomorrow night or something. The whole day is there, so we'll have some idea that what exactly is going on. Okay, so at least 10 clinical trials on streptococci infections. Okay, which should be, which not always, but maybe this thing in where the manifestation is by means of what we call rheumatic diseases. Okay, rheumatic fevers, rheumatic diseases. Okay, so those who are having ekdam knocking this thing, exam is knocking on the door, they may refrain from doing it, but in free time you can also Google and prepare something, so that later on you can put up and make a cocktail and then submit. Okay, later on. So by saying so, we can have a little recapitulation. Yesterday we have spoken about very basics of this, what we call as immune response, and then today we one of the student has spoken specifically for rheumatism. So I thought why not put both of this. So autoimmune condition we will do day after tomorrow. परसों जो है हम जो ऑटो इम्यून एस्पेक्ट जो है उसको एकदम ये कर लेंगे, और इन बिटवीन इफ यू आर हैविंग सम डाउट we can also discuss. Okay, I'm sorry, yeah, you was a bit
Sir,
late today.
sir,
Okay,
today
yeah, go
you
on.
spoke about, yes, sir, today you spoke about in the last part about the low grade fevers. So, what it is called as?
uh, the fever.
Yes, sir. You told that our doctor will not able to detect what it is.
Okay,
So,
okay,
they
okay,
at
okay.
first.
I understand. So many a times these days they'll understand that the low grade fever repeatedly, and the age is also very important. Age is in females, it is during the adolescence or something like this. Very young age, from usually 11 years to 17, 18 years, where the immunity is also very not very strong, and some kind of their socio-economic background is also not very strong. Okay, a little bit compromise in hygiene and health and hygiene issues. So in those cases you will be frequently see this. Okay. So what happens is the patient will repeatedly this thing for a fever, no, low grade fever, and some sort of joint pain or something like this. So the doctor will get confused that why this is happening. So initially he will think for this thing tubercular infections. So once the tubercular infection is ruled out, then the most alarming thing will be change in CRP and change in ESR. Okay, so there must be some kind of inflammation, doctor will understand, but he will not understand why this thing is happening. So once he gives it ASO test, then suddenly he will see that something is seriously wrong, because the normal range is 200 odd units, but in this case the female is having female or male also, many a times female, so it is not RA, not completely autoimmune rheumatic arthritis, but it is rheumatic fever and rheumatic disease. So in that case what happens?